Hi, my name is Sanaa Kader. I'm a dentist. I'm speaking to you today here from Bradford Dental Clinic, and I also own Indigo Dental in Leeds. I'm a principal and a practice owner, and I'm a GDP. I'm very much a GDP and proud to be. And I carry out multidisciplinary treatments as well. So I use ClearCorrect aligners, we use Straumann dental implants, we do Smile in a Box, and we use Smile Cloud for multidisciplinary treatment planning. And those are the kind of cases that I really enjoy. I have been working with ClearCorrect as a provider since it was launched in the UK, so I have been very privileged to see ClearCorrect grow and develop into what we see today. The biggest standout for me, I think, is the support, not just clinical support, but also full practice support, team support, training and resources. My journey with ClearCorrect began when it was launched in the UK in 2017. And when it was purchased by Straumann, I was already using Straumann implants, so I thought this is a match made in heaven. I've got to try their aligner offering because I already knew the support from Straumann as a company was brilliant. So that for me was the game changer, the fact that I could get the same level of support that I always received through Straumann as a company. The best thing about the ClearCorrect submission is the ease and how friendly it is to use. We can use the Sync app, which is an app that has been launched to make it easy to submit your photos and scans directly from your scanner. You can also use the computer, which was the traditional way of doing things, but both options are really good options. It's a direct bridge from the scanner to the ClearCorrect portal, and the photos are a direct submission. It literally takes minutes. You can actually train a member of your team to help you upload the photos and the scan and save that as a draft and come back and put your clinical notes in and what you want the technician to do. Whenever we've needed support from ClearCorrect, whether it's for something to do with a specific case and we need some additional support, it's very easy. We reach out to the ClearCorrect support team by email, or we reach out to our local rep, and they get the problem resolved really within 24 hours. They say 24 hours, often we get a response even sooner than that. The standout experience for me, I would say, as a practice owner has been the support that my reps have provided with training my team on scanning. So scanning is an integral part of the workflow for ClearCorrect, and reps have been brilliant, and they've come out and they've trained not just me, but my associate dentists, nurses, hygienists, front of house. And for me, that's standout because that's really helped us accelerate our ClearCorrect journey at the practice. With ClearCorrect, we have been able to deal with malocclusions that we previously would have thought were specifically only for orthodontists. But that's not to say that ClearCorrect only does those kind of malocclusions. We also have the everyday patient who just wants to improve their smile. So using some ClearCorrect aligners to align the teeth, and then maybe doing some multidisciplinary work such as whitening, bonding. Those are our everyday patients. In addition, we've treated lots of cases with ClearCorrect aligners and also dental implants with Straumann, and those kind of cases have been really rewarding and challenging, but also very rewarding because those are the life-changing cases where patients have a problem, they need a tooth, they want to align their teeth. Those cases for me personally have been the most rewarding and most satisfying. I completed a case in a multidisciplinary setting, and I actually did enter the case for an award. And it was a case of a young lady with a tooth at the front which was discoloured and had a history of trauma. She also had severe crowding and she needed a dental implant, but due to the severity of the crowding, there was no space to place the implant in a good way, in a predictable way. So we removed the tooth, we used the ClearCorrect aligners to align her teeth, and we utilised a Pontic inside the aligner. Once the teeth had aligned, we then used the Straumann Smile in a Box implant pathway to place the implant using a fully digital workflow. And that was a real life-changing case because for that patient, the confidence improvement that she got, she was able to apply for a job. So teaching was her dream job, but she had no confidence. She felt unable to stand in a classroom in front of children and stand up and teach, and she was very self-conscious. And she started the treatment, she applied for a teaching role, and now she's successfully working as a teacher, and she's confident, she's living her life, and she sends lots of referrals to us because the treatment genuinely has been so life-changing for her. When patients are coming to see us and they're interested in ClearCorrect aligners, one huge advantage is that we can take a scan and photos and upload onto the ClearPilot software. Because ClearCorrect offer a free case setup, there's no commitment to us, the practice or the patient. So it's a really good way to get patients who are maybe unsure about the smile improvement we can offer to have a look and see what we actually can do for them. Because for many people, they want to see something. They can't just go on our word. They need to see some proof, if you like, or a smile design or a mock-up. So the free case setup, I think, is really good because it opens the doors to seeing a lot more patients. It can take minutes to do a scan and photos. Your nurse can do it for you. Your team can do it for you. And it allows you to enable more patients to get treatment. For us, having that free case setup has meant we've been able to smile design a lot more patients, which has led to a bigger uptake of patients. We've done better quality work. We've created a reputation, and we get lots of referrals from family and friends and other dentists in the area who have seen the work that we can do and recommend us to their patients and to their family and friends. ClearCorrect has a vast range of resources which we use in the practice to help us deliver the highest level of patient care. The first step is when the patient comes in and has their consultation with the dentist. They will have the scan and the photos, and we may use the Sync app to upload onto the ClearPilot software and create a setup. However, before the patient leaves, we ask them to see our TCO, our patient coordinator, and what they will do is they will go through with the patient the Clinic app. The Clinic app is a vital tool for your front of house team or for your TCO, because that will provide them with content that they can show to the patient while they're there in your practice. For example, your patient has crowded teeth. Your TCO can navigate to the crowded teeth section on the Clinic app, and they can go through with the patient a series of slides that demonstrates what crowded teeth means, what the implications of having crowded teeth are, i.e. they may get perio disease due to not being able to clean properly, and therefore they may end up with consequences of gum disease, which can include tooth loss. Now, I'm not saying that everything is always in that order, but the Clinic app provides a vital way for a TCO to give information without giving clinical advice. And actually, patients find it really useful because it's in video content, it's easy to read, it's easy to understand, and it can be really useful to help patients understand what's going on with their mouth. And we strongly believe that educating our patients is really important so they understand what's going on with their teeth. It's part of our digital workflow with the scanning. So this Clinic app is brilliant. The Sync app makes uploading photos and x-rays and scans really easy. We also have the ClearPilot, so when we get the setup back, we go through that with the patient, and that will show the number of aligners, the series of steps, how the teeth are going to move, what the outcome will be. These are the important things that the patient will want to know. We can give them lots of information about the clinical steps involved. In addition, we also have lots of other tools for the patient to use, so they can see their setup at home. A link can be sent out to them so they can view their setup at home. We often hear from our patients that they've shared their link in the family WhatsApp groups to show their family members what their teeth are going to look like, because it creates excitement, and that's what we're trying to do. For people who want to get involved with ClearCorrect in education, I think the best way is to first go on Ortho Campus. Ortho Campus is a free resource. You can go online, register, make an account, and there are hundreds of videos on there. I mean, you could spend all day on there going through videos. And if you're treating a patient and you have a problem, let's say you have an engager that keeps coming off and you're thinking, why is my engager coming off? You can go on Ortho Campus, search engager, and you will get relevant videos and articles that you can read to enhance your knowledge and learning. So rather than having to ask people, and you can ask people, but rather than having to ask people, the first thing you can do is go and read and watch the video and learn about it yourself. In addition, we have clinical advisors, which are now part of our ClearCorrect team. And these people are brilliant. They are an amazing wealth of resources and education, and you can reach out to your clinical advisors. You can book a session with them and talk to them about a case or any problems that you may be having. The accreditation course that we hold with ClearCorrect is the perfect way to get involved with doing ClearCorrect aligners. If you've no knowledge of aligners, you've never done any ClearCorrect aligners, and you want to get involved, I strongly recommend you come along to a ClearCorrect accreditation course. We run these many times over the year in different locations, so wherever you live, hopefully we can find somewhere close to you. The ethos of the ClearCorrect accreditation is to hold your hand and take you on the journey from complete novice to ready to go with aligners. It's run over 2 days, but it's not 2 consecutive days. You have day 1, you have the training and the virtual study clubs, and then you have the day 2 to allow time for you to find your cases. And speaking of cases, they've made it really easy on the accreditation course because you get your 3 free cases, 3 unlimited cases included in the fee that you pay for the course. So there's no drama, there's no thinking about which case do I select. You just come to the course, find your cases, you have the 3, you get going. You get the sessions with the clinical advisor as well. So the clinical advisors will prioritize you during the accreditation, and you will be given dedicated slots because you're on that course, and they will then guide you with your first 3 cases to ensure that your setup is correct, your practice is ready to go, and you're confident to treat your patient. You have 2 virtual study clubs, and you also have a virtual study club to involve your team. So how can you get more patients through the door? How can you do more clear correct? That will include things like promotion on your website or on your social media, speaking to your team, training your front of house for inquiries. It's all in there in the accreditation course, and you will get all the support from your rep. They will send you marketing materials, you will get leaflets, you will get bags, posters, anything you need. If you want to run an open day, your rep will come out and help you. They will hold your hand and do everything for you. You don't need to think too much. So if you're unsure, get yourself onto an accreditation course and come and see what it's all about. SmileCloud for me in our practice has been a game changer. We have found huge success with getting patients in and doing an instant smile design. It's quick, it's a click of a button now with 3DNA. It's made it really easy. All you need to do if you want to do a smile design is take some photos of your patient, upload them onto your SmileCloud, and with a click of a button, you can do a smile design. And for patients, this is a game changer because everybody wants to know, what will my teeth look like afterwards? However, that's not all that SmileCloud is. SmileCloud can be a portfolio, it can be a catalogue to store all your scans, your photos. You can upload your CBCT on there as well. And actually, it's quite a nice summary of what you're looking at. You can use that to send to your local labs. So if you want to create a smile design, you want to do a porcelain case, anything you want to do, you can liaise directly with your laboratory on SmileCloud. So it's really multidisciplinary in the sense that it crosses beyond just what's happening in your surgery. It can be linked up with labs, etc. You can use it for planning with other dentists as well. So let's say you have another dentist and you're working together. Rather than waiting, we all work different days in practice, don't we? We don't always be together on the same day. So actually people can view the cases on SmileCloud and things can be planned together. You can plan things in different countries. It crosses all borders basically, and it makes life a lot easier. The point of the smile design is to improve your workflow, become more digital as a practice, and provide your patients a better journey, because that's what it's all about. It's about the patient journey. So providing the patient an indication of what their teeth would look like afterwards really can transform your practice.